I want to take a quick minute to share a little bit of information based on a research paper that I just finished reading called Vertigo in Patients with Cervical Spine Dysfunction. And one of the reasons why is because I think it can help a lot of people, and this is highlighting something that's commonly overlooked with folks that are suffering with vertigo. Now, vertigo is that uncomfortable sensation where almost like the world is spinning around you. It causes a lot of folks to have nausea, vomiting. It just wipes out your energy. It's a terrible thing to live with, and it's debilitating because it keeps you from doing different things that you should be able to do, like driving your car or engaging in physical activity and exercise that you enjoy, that sort of thing. So it's the type of thing that you can't see though, right? If you have broken your arm and you have a cast on it, everybody's aware that you have this limitation. But things like vertigo and migraines and these types of disorders, you don't see them, right? So you might be encountering people that on a routine basis that you don't even know are suffering with this type of thing. Unfortunately, a lot of the folks that I've worked with that have vertigo, they've tried all kinds of other treatments and have, either gotten marginally better or it didn't work for them at all. And the conversation that we have as they're sort of, exploring their last resort or, just another option is that there are things that cause vertigo that are commonly overlooked, unfortunately, in other types of healthcare settings. And mainly the cervical spine dysfunction. When it comes to chiropractic, we want to look at the role that the neck, and specifically the upper neck, has to play in an experience like vertigo. The upper neck is very neurologically sensitive. That means that all the nerves in the body enter the brain through the base of the neck. So it's highly, highly sensitive. So positions of head and neck, the orientation of the head and neck, movements of the head and neck play a very vital role in your spatial awareness, which is basically your body's perception of where it is in its environment and surroundings. So depth perception, where you stand in the horizon in gravity, are you upright, are you leaning, are you falling? These types of perceptions all have to be filtered through the position of the head and neck. So there's a few different systems that the brain will sort of check on to make sure that you're maintaining your spatial awareness and that you're comfortable in your environment. The eyes are a big one. The inner ear is a big one. And a lot of folks that get car sickness, they can experience when there's a lack of harmony between the information from the eyes and the inner ear. That's where you get that sort of queasy feeling. Your brain is getting mixed messages about how your body's moving through space, and it causes a very uneasy feeling. Another system that we need to consider is the cervical spine. So what's the position of the head and neck? What's the balance of the body in space? And how does that feed back to the eyes and the inner ear when you're moving? So this particular study wanted to take a group of patients that have vertigo and evaluate them for cervical spine dysfunction. So what they were doing is basically seeing, well, we know these patients have this experience of vertigo or have these symptoms. What could be going on? Let's check the neck. Let's see if there's anything that's going on in this part of the spine that's contributing to that sensation. And so in true research fashion, what they did is take a segment of patients and treat their cervical spine, and take a segment of that population of patients and don't treat their cervical spine. And what's really interesting is in the patients that they treated their cervical spine, they found that almost all of them, within 2 weeks of starting treatment, noticed an improvement in their vertigo. So that can be huge for people that have been suffering with this sort of thing because they're less limited. And as short as 2 weeks, I've seen folks that have suffered with vertigo for years. And if they could see an improvement in 2 weeks, it would change their life. In the other group, they didn't really see that much of a change, right? Nothing was done for them, and so their situation continued as status quo. At a 3-month follow-up, almost all of these patients, the vast majority of these patients who had their cervical spine treated, reported that if their vertigo wasn't completely gone, it had improved so much that it radically changed their functionality, meaning the way that they can interact and the things that they can do in their life. And that's why it really matters. Vertigo in and of itself and feeling uncomfortable, that's not pleasant, but when it affects your life, that's why it becomes problematic. So for patients that are suffering with this sort of thing, I'm always very confident that we're going to be able to help them because, and the study showed the same thing, these folks very commonly have atlas problems. The atlas is the first bone in the neck. It causes a lot of imbalances throughout the body that can feed into that sense of uneasiness or loss of spatial awareness, and that is what triggers a vertigo spell. So if you know folks that are suffering with that sort of thing, tag them in this post, make sure that they see this information because it's easy to identify when these folks might have cervical spine problems. In the study here, they basically looked at range of motion. Can you comfortably change your head and neck position, and is it the same each way? Can you move as far as you should comfortably or not? And with a lot of these folks, they weren't able to. So it's a very quick screening to identify when you might have a cervical spine component to an experience like vertigo. And then once we get them in the office, we do a lot more thorough evaluation. We look at that sort of thing, but we're also going to palpate, move the joints of the neck, see how they feel. We're going to do neurological testing. We're going to do imaging to measure the displacements and figure out exactly what's going on. But that can be a quick screening tool for folks that are having vertigo to understand when they might start to seek out some treatment for the neck or the cervical spine. So it matters to people who are living with this. And so it's important that they consider this option so that they can have a quality of life and that they can conservatively get care that's going to help.